Now we'll call it to order. Still 7:32 p.m. Fairfield Board of Health.
Hi, everyone.
Hey there.
Hi, I'm sorry, it's Henry Yoon.
Oh, Henry, you're here.
Henry,
Okay,
Mark.
great.
Welcome, guys. Thanks for joining us. We'll start with our approval of the last meeting minutes. Hopefully everyone had a chance to review those. If there's no corrections, I'll entertain a motion to approve them.
Motion.
Okay, is there a second?
Second.
All right, any opposed to the approval? All right, hearing none. Minutes passes as written. Sam, we'll start with your report.
Sure. So not a lot to present tonight, but I thought I'd do a quick, because I thought this was interesting in one of the epidemiology updates I get, talking about this is the, U.S. Percent positive of respiratory virus going on throughout the year, and you can see the different, up here, influenza. But the one that's interesting that they were highlighting was this one where RV and EV, which is, common cold, is starting to see a big resurgence now going up, which they didn't go into an explanation of it, but it's interesting to see colds going up in May. That's why I was sort of asking to see if you were going to say, yes, we've got that at the...
Yeah, but that's interesting, because just from a testing standpoint, not commonly tested for because it's a separate panel, at least in our hospital, COVID, flu, RSV are one panel, the whole respiratory panel is another one, and we almost never run that except for on admitted patients.
Yeah.
So I have to wonder, why this test is even
what's
occurring,
the end here,
Yeah.
And is that's definitely a test too, and not allergies.
Yeah, these are, percent positive of tests.
Yeah.
And so, the end for that percentage could be very small, but, and this gets a lot of the laboratory stuff, so, so all the labs are electronically reporting, so. But, so I thought I'd share that's what they're seeing. And then in Connecticut, we are still sort of on this downward trend back to sort of almost background, but not quite for COVID, flu, and RSV, which we're happy to have it. And then in terms of H5N1, what's going on? Still 70 cases, 1 death. It's, we're not seeing the kind of big increases that we are seeing, less activity. It's kind of starting to stabilize somewhat. And then I thought I would share a little bit of what's going on locally from the beginning here. So let's do this. Display settings. Just to bring it over here. So this is a 24-25 comparison from January 1st to today of the cases that we're seeing of different communicable diseases. You can see we have about almost 800 additional reports, but you can see that it really is solely due to influenza. It really is the big jump here. And so this, what we typically do is say, okay, well, why did we see this, or how did this happen? And I did a comparison of 24-25 compared to 23-24. The blue is 23-24. You can see we just have that many more cases going on this year for influenza, than in previous years. But everything else seems to be, there's some ups and downs in tracking of things, but no significant jumps or things popping out there. This is the measles outbreak, and so you can see with the epi curve that we're starting to show signs of cases decreasing, as well as up at the cumulative total over on the right there. You can see it's starting to level off. I'm trying to think if the slide had, but we're now I thought I had it. But I thought I had it on here, but it's 1,100 cases or so. We're still behind Mexico and Canada, but they're both having their own outbreaks of this now. But yeah, again, you know, they had that dramatic increase there, and then it kind of is starting to level off, and the other states are not seeing as too much. This is the, you know, case by rash onset date, and so you can kind of see it starting to taper out a little bit. You know, it kind of goes down on a spike, goes down a little spike, and, but you can see we're kind of trending downward there in terms of new cases. Yeah, 1014 is the total. You know, Texas and New Mexico having, you know, Texas having, you know, nearly all of them, and then going down. But we're at 30 states now, so it's sort of like, it's going to happen probably, you know, most everywhere. We'll probably get a case eventually, but only really the two large outbreaks, some medium-sized outbreaks, and then a few small outbreaks.
I'm just curious, do you know, are the smaller outbreaks all little clusters of, yeah, like families or similar communities, like in the states like California, Michigan, where it's like 9, 10, like is that like one real grouping, or other people that maybe were transient, like the CDC kind of put it out there at all?
Yeah, so it's yes, it's like there'll be a case and there'll be a few cases around that within that group. Some of the smaller ones are, you know, sort of travel related, which we see routinely, you know, throughout the year. But, you know, we're approaching the highest level in 20 years. We haven't passed it yet, but we're approaching that. But yeah, it's, you know, it's definitely mostly, a lot of it is, you know, related to the Mennonite community. That's what's going on in Texas, and then a lot of the other ones are the same community, but then some of those are just, you know, person-to-person transmission. And we had our Girl Scouts and Government Day this year, just last week, was it? I think it was last week, yeah. And so they're, Kim and Melissa are taking the two young ladies that we had to go, who knows what this is? I'll ask that.
Right.
Water testing?
Are they at River Lab, like the mill?
They're near the Mill River, but it's that, you know, that little park that's like a little in the wetlands that kind of is set down by Mill River, down by Unclewood Bridge.
Okay, yeah.
Is that the one where all the field trips usually go? Like they do like the walking path back there?
Not quite. That's up the stream about 200 yards.
Okay.
This is just under the bridge on the Fairfield side of the bridge. There's a little walking path through there. There's a lot of occasionally stagnant water in there. So what we're doing here is dipping for mosquitoes to see if there's any mosquito activity. Yes, we're seeing. So we'll send people around and just kind of check some of the typical areas to see like what's going on and is there activity. And so that was that. And
Did you find anything?
They did not.
Good.
They did not find anything. Yeah, they're tricky. You know, you really have to do it a bunch of times to figure out where they are and where they're hiding. And you know, even if you walk if you don't walk gingerly, walking up to it, they feel the footsteps and they go down. You know, and so they're very crafty. But so you know, we had the budget meeting with the RTM, and everything went smoothly with the presentation. I had the opportunity to go on a quick vacation, and so Santina took the lead and was there in person, and I was on the line from Florida. So, and she outed me on the call, you know, says, Sans is vacationing on the beach in Florida.
Yeah, convenient timing there.
But it just showed your dedication that you called in from your vacation.
That's it. But so we had the final vote on the 5th, and everything went fine. No cuts to us, no significant cuts to most of the departments. So we're happy to have that, and so we can move forward and put that behind us for a good 5 or 6 months. So we continue to meet with the Safe Streets Alliance. So Santina and I are working with the Selectman's Office, along with police and fire and bike ped committee, and to basically we're planning a campaign. I think I've talked about this before, of improving road safety. and getting people to change their behavior. And so we'll do a big launch event, probably third week in June. There's a couple dates there that they're planning on, but we'll do a big launch event to try and promote it, get sponsors, and basically we're going to have, like the signs you see in Strathfield, like, slow down Fairfield, we'll be purchasing lawn signs like that are about, slowing down and, that passing the message that road safety starts with you is the theme of it. But we'll have people sign a pledge at that event, and then there'll be different pledge locations that you can go to and sign the pledge. And when you get the pledge, you get a car magnet that says, "I signed the pledge, road safety starts with me." And so you risk getting judged while you're driving, having that on your car, And I think I've said, it's just, I drive around the town car and it's like impacted me like, all right, I got to slow down, and make sure I'm, following the speed limits while everybody's mad behind me.
Any physical measures planned for, like altering roads for slowing traffic down or anything?
So that's part of the overarching process. So Bike Ped is always working on that. The engineering department is always working on that. And so this group is really just about the promotional campaign.
Okay.
But yeah, they've already done the rotary on Reading, is it? Reading and Dunhill, that three-way intersection there. They put in the traffic circle there. We had a launch event there, press conference there about that. And there'll be additional things going on throughout the town related to that over the next number of years. But basically trying to introduce, traffic slowing measures. And, but this is more about awareness. Where the town signed the Vision Zero pledge, which is to eliminate serious vehicle pedestrian accidents to eliminate them by 2034. And so this is a part of that effort to start that. And the idea is to sort of, like Mothers Against Drunk Driving did to drunk driving, is we're trying to change people's attitudes about how you use the streets, and that it's as the theme says, it starts with you. Like if you're speeding, well, you're you're contributing to the risk. And so it'll be a launch event, then it'll be a series of sort of press releases. We'll do social media push. We'll be doing radio spots. We'll have a video, and so a big push for 3 to 4 months of just trying to sort of get people to change their attitude. We have a pre-survey, post-survey. We have some quizzes that we're asking people, like, do you know these road safety facts? What do you do at a four-way intersection? Who goes first? That kind of thing. So we're continuing to work on that. We did, as a part of that, several members of the group went to the Fairfield Ludlow mock crash, and I don't know if any of you have been to that, but it's really a powerful event, where they sort of cover the vehicles and then they pull it off, and there's actors in there, students, and they run through a whole crash scene with police and fire coming and ambulances and fatalities and body bags and, the student actors screaming. They have the, dispatcher there with a microphone running the scene as if it was real. So very powerful event. I had never seen it there. They've been doing it for years, but I've never had been a part of that. So.
Any plan focused on the scooters?
Yeah, that's what I was thinking.
Yeah, no, it's the e-bikes, the scooters, bikes, bicycling, walking. It's all about everything.
Yeah.
It's just trying to get people to say, hey, each of these comes with certain rules, and.
Well, the bikes, the drivers, the walkers come with certain rules, but I think what you're asking, not to put words in your mouth, is like they're still not the right defined rules. They haven't been brought up to speed for the e-bikes and, the things that are as fast as other things that you don't need licenses for. And so that's the thing that's really out of everyone's hands. I think that's the biggest problem, but, you know.
Yeah, I mean, Post Road, I see them weaving in and out of cars on these little scooters, and.
Yeah, I mean,
It's not the drivers that are the problem, it's the scooter people.
No, they're going like the same speed
Yeah.
sometimes as a regular car, but don't know the rules of the road, because they didn't have to know the rules of the road, because nobody's saying they have to know the rules of the road. I mean, that's like the bigger problem, so, I mean, I understand the
Yeah.
campaign, but it feels a little bit like, without addressing some of those, like, underlying ideologies, it's gonna continue to be problematic.
Well, those are discussed at every meeting.
Yeah.
Of the e-bikes and the things that, what, you know,
I know, like,
strategies
who's
to address
doing
the
something
e-bikes
about it, though?
that go to.
Like, I remember for a while, even the police officers in town were, giving away, like, free ice cream coupons or something when kids actually were wearing helmets on their bikes. I'm just wondering if there's any sort of, like, proactive, positive reinforcement, strategies that are coming into play in the campaign, other than, you know, I get it, like, the slowdown, but everybody's like, as soon as they're in a rush to be somewhere, like today when the traffic was, I have not seen it feel like that bad in this area downtown. I was there earlier with the construction. It was impossible to move anywhere. People get frustrated and they don't make the best decisions, right?
Yep, and that's the goal, is just to get people thinking of a series of different pushes throughout the campaign, to get people to think about it a little bit more, to get, you know, some visibility with the yard signs and the magnets, to have that, you know, a big push so everybody hopefully sees something different in the community and adheres to it, or wants to know about it. So those things will drive them to a website that talks about what we're trying to do. And but yes, all those things are a part of it. Yeah, the incentive things, it's all been discussed, and it's all stuff that the group is trying to work on to implement, you know, positive strategies that work to change the behavior. So we did conduct the department conducted a sort of internal call center exercise this past month, where we set up the Fairfield Call Center here in this room, you know, which is, you know, basically we have this portable bag with routers and 10 phones and headsets and all that, and we use that during times of emergency. The health center is responsible to sort of set it up and get it running, and us and IT will sort of staff it initially if we're not involved in the incident. We set it up a couple times a year just to test the equipment, make sure it all works. We try it in different locations. We've done it in the schools, we've done it at the senior center, we've done it at the nursing office, we've done it in this building. And so we continue to try and just make sure everything's up to date. You know, we learn every time something different, you know, like the voice message was not right when we did it this time. And last time in the schools, you know, there was a wrong setting on one of the systems that wouldn't let it do it. And one time the phones hadn't been updated, so it took, you know, 10 minutes or so for the phones to update themselves. So we continue to try and exercise that, and so have everybody, as we do have some newer staff here that haven't necessarily done it themselves. So we, you know, I sit back, IT sits back, and we just say, here's the directions, do it, you know, and they get it done. The federal grants that we had a pause on, they had 2 extensions on that, and so we were able to bill, you know, the expenditures related to that up until April 29th. Yep. And so that was good for us, and we're waiting to see if there's any more. You know, the court cases are still going on to see if it'll extend them a little bit more. We've spent down almost all of it, you know, anyway.
Yeah,
so
for ELC2.
For ELC2, which was the one that went longer, that went to 26. And then our immunization grant was just going to June 30th, so we had spent down, there was a little bit more there, right?
Yeah.
Left, but.
Is there anything that you applied for or plan to apply for that you don't think is going to happen now as a result? Or did you know, just simply not because you thought it just may not get there?
There hasn't been anything that we've said no to, like that we haven't applied for, but there really hasn't been much other than we're waiting to see, one of the question marks is the preparedness grant. So we get, $34,000, something like that a year. We have 2 very part-time people that work on that. They do it for several towns to sort of update our plans. They coordinated the call center exercise, things like that. But there's a question mark of whether that will actually happen. We're in the first year of a 5-year cycle. And so we're surprised we haven't heard yet, but that's probably the one. If one would go, it would be that one, given that they've, rescinded other sort of, while they called it COVID money, they repurposed it to do preparedness activities for some of those grants. So we were doing some of that. And they said,
Does that come from the state through?
So it's a federal pass-through, so it originates from CDC, and then goes through, the state is the applying entity, and then they subcontract to the towns. And so, that dollar amount's been coming down, the first 2002 dollars were big and then got bigger, and then they've been coming down ever since. But if there was another one that went, we would think it would probably be the preparedness grant. Some of the other ones, they've already changed the format. The ones that we typically went for, like they made them competitive grants, but the workforce development one that we have, they funded us up front, so the state got all the money, and then they sent out all the money, so we don't think that they'll be able to, the feds will be able to claw that back. So we don't think that one will go away. And so we'll just wait and see. I mean, everything at the CDC is kind of on pause now, and the staff there says, we don't know. We don't know what's going to happen. So eventually it'll be clear, because that grant, the preparedness grant, has to be signed and processed in a couple weeks. So we did have the commissioner semi-annual meeting on the 5th. Commissioner did a town hall style up in West Hartford, where she just had people submit questions. The directors of health all got to submit questions, and she just kind of sat in the middle of the room with a microphone and kind of answered all those questions and then took questions. It was a different type of format than we've had in the past of, sort of PowerPoint feature what is this health department doing, that health department doing. But it was really a lot about the federal changes and, what she knows and what she doesn't know. And, sort of the commissioner is very accessible and open. One of the commissioners I've had the pleasure to serve under. She's, very much in touch with the local directors of health, getting the opinions, getting feedback, providing answers and resources to us as best possible, given the uncertainty of the circumstances. And she's a Fairfield resident. So I think that is everything I have. I think I covered it all.
So just some of the programs we're doing. So we started our Matter Balance, which is the fear of falling program that we have with the Senior Center. We have 10 people enrolled. It have max of 12 people, so that's per the program that's run through Maine. And so we had 2 people that ended up dropping out, and unfortunately, once we kind of start the program, we can't allow people in after the second week. But we have a group of 10 who have been coming consistently so far for the last 3 weeks. So that's going really well. That goes until about June, the mid of June. And then our diabetes and chronic disease support group, over the last few months, our numbers have been dwindling. And it's been really hard to get providers to come in to talk to a group that you say, we have 8 to 12 people come at a time, and 1 or 2 show up. And so around the same time, the registered dietitian we ran it with, she has stepped back. And so I was talking with the senior center, and we think instead of labeling it as like chronic disease and diabetes, because it might deter a few people, we're just going to partner health department and senior center and do like a health topic of the month. And so like this month will be osteoporosis, so we have someone coming in for that. Next month we're hoping to get a dermatologist in to talk about, prep for the summertime and sunscreen and things like that. So that it's just changing a little bit. As Dan said, we submitted the financials for the ELC2 and immunization. On May 1st, I attended the Community Health Improvement Plan Development Committee at the St. Vincent's. So we did our community health needs assessment, and now we're at the planning stages. And so it was a really good 2-hour work and lunch meeting where we looked at our goals and tried to come up with strategies to achieve those goals. And it's still a work in progress. QPR, we did it again at Sacred Heart University. So we've been invited back 3 times, and we've trained probably about close to 40 students there. Every time we do it, it's so worth an evening time, right? To be in a classroom of, 10 to 15 students and not one of them lift up their phone it's really great. So we're excited that we're doing that. I did reach out to Fairfield University, see if anyone's interested there. Haven't heard back. But this is a group that we're really, that we think are getting a lot from it. So we're excited about that. May 19th, hopefully, we're going to have a summer intern starting. He is an MPH student at Fairfield University. He's going to be helping the environmental staff here do water samples. He's going to do a project related to the water quality over the last few years. And then some sort of video or informational component as well. And then just our social media, we've have been promoting a lot on, what is it, Tippet?
It's tip or treat time.
Tip or treat time. So if you've seen our social media, you should. It's super cute. Sam's had this idea for mosquito awareness, right? So tip over your stagnant water. And so we have mosquitoes on broomsticks on our social media, and we've been really trying to push that out.
Tip it over, or you treat it with larvicide.
Yeah.
Yeah.
And I think that's it.
We have 3.
I think we had like candy involved or something, an early Halloween.
It's funny, the first comment we got, I think the only comment we got from somebody is like, "This is great, so informative," and if you click on her profile, she's like one of those extreme house decorators, and she's like dozens of pictures of Halloween, and it's like so into it. And I sort of wonder if she has some like filter set up, like there's a Halloween like post.
You hit the algorithm.
Yeah. So tip or treat, and then what's the next one? Is are you a good tipper? Right?
That's cute. That's good.
Yeah, and then there's a third one, which was I forget now.
So Emma's been creative. Emma's been going back and forth with Sans as the creative brain, and Emma has been creating these on Canva.
So I get up in the middle of the night, I'm like, all right, I gotta write this down. Next morning, I'm like, all right, send off an email.
There's a big genius at work there.
The creativity of public health. One idea, I don't know if this is appropriate or not, but just since you mentioned the intern, and that it had to do with water, I'm sure there's a lot of people in Fairfield, myself included, who've not dealt with yet the fact that those letters went out with like the lead. If there might be kind of an interesting way to have an educational component, like of kind of next steps, because I don't know how thorough that was from, I don't know if it's appropriate to kind of work that in or be a reminder, just like what situation.
Yeah.
I'm like, okay, we lived with it for how many years? What's it gonna do now? No. But in seriousness.
Yep.
Cool. Thanks, guys. Great reports. Any communications?
None.
No? All right. Any old business?
We have none.
But we do have new business.
We do have new business, so last month in the attachments, we sent around the annual report, and so just thought we would seek your input if there's anything you want to update, change, edit, and if not, we just seek to get it approved so we can put it up on the website and get it ready for our next round of grant applications. Always ask for your annual report, so.
Was there any feedback on the report?
No, that was good.
Great, thank you.
We have a motion to approve.
Motion to approve.
Okay, second.
Second.
Any opposed? Hearing none, publish report.
All right, thank you very much,
Nice
I
job.
appreciate it.
Any other new business tonight?
We have none.
I'll just bring forth, we have a new member, right?
Yep.
I saw that in the email.
Yep,
Not here tonight, but,
Nina Chanana,
okay.
I think it's right,
Mm-hmm.
that's how you say it?
Maybe we'll see her next one.
Yep, we've worked with Nina for years.
Oh,
She's been a part of, she's been a consultant for community health improvement plans and community health assessments for the Health Improvement Alliance.
Mm-hmm.
You know, I don't think she's this year's consultant, but she's done it a number of times and has been around, sort of in the circles. So it's great to have her. She's, you know, very knowledgeable about local health and health departments and health, you know, improvement plans and quality improvement. So it'll be great to have her.
Cool. We'll look forward to meeting her.
Hopefully guilt her into doing some work for us for free.
And with that, I'll entertain a motion to adjourn.
Motion.
Okay,
I can do it.
great. Any opposed? All right, hearing none, we are adjourned at 8:04.
All right,
Good
thank you,
job.
everyone.
So efficient.
Thank you.
Short and sweet.
Thanks,
You
everyone.
guys.